Today we're diving into something that's been making headlines, the human metapneumovirus outbreak in China.
Yeah,
It's a topic that's, gaining attention and deserves a closer look.
absolutely. So, what exactly is HMPV? Is it something we should be worried about?
Well, it's a respiratory virus that's been around for a while. HMPV was first identified in 2001, but evidence suggests it's been present since at least
Mm-hmm.
1958. It's kind of like a cousin to RSV and the flu.
So, it's part of the same family of viruses that cause common colds?
Exactly. It belongs to the Pneumoviridae family, which includes respiratory syncytial virus, RSV. It
Right.
can cause symptoms ranging from mild cold-like issues to severe bronchitis and pneumonia.
Who's most at risk with HMPV?
Well, it can infect anyone, but it's especially concerning for young children, older adults, and people with weakened immune systems, similar
Got
to
it.
the groups most at risk for COVID-19.
Speaking of COVID-19, are there similarities between the two?
Yes, there are several similarities. Both viruses affect the respiratory system and have overlapping symptoms like cough, fever, nasal congestion, and shortness
Oh,
of breath.
wow.
This can make it difficult to distinguish between them without specific testing.
How do they spread? Is it in the same way?
Exactly. Both spread through respiratory droplets when an infected person coughs or
Right.
sneezes. They can also spread through close contact or touching contaminated surfaces and then touching your face.
So, the same precautions we've learned for COVID-19 apply here too?
Yeah, absolutely. It's like we've already got the
Mm-hmm.
playbook. Hand hygiene, masks, social distancing, all still relevant with HMPV.
Does HMPV have a seasonal pattern like the flu?
Yes, it typically circulates during the colder months, peaking in late winter and early spring. So we're right in the
Gotcha.
thick of it now.
Is there a vaccine available for HMPV?
Unfortunately, no. There's currently no vaccine or specific antiviral treatment for HMPV. That
Oh
makes
no.
prevention even more crucial.
So, what can we do to protect ourselves and our loved ones?
The basics are key. Wash your hands frequently with soap and water, avoid touching your face, keep your distance from people who are sick, and practice good respiratory hygiene by covering your mouth and nose when you cough or sneeze.
Right.
Also, avoid sharing personal items like cups and utensils.
It's amazing how those simple steps can make such a big difference.
Absolutely. Sometimes we underestimate the power of basic hygiene.
Definitely.
These measures are our first line of defense.
But here's a thought. Since HMPV has been around for decades without causing a global pandemic, are we overreacting to this outbreak in China?
That's a fair question. While HMPV isn't new, the recent outbreak indicates it can cause significant health issues if not monitored.
True.
Plus, with today's global connectivity, viruses can spread faster than ever.
So staying informed is crucial, even if it hasn't been a major issue before.
Exactly. And after everything we've experienced with COVID-19, it's important not to become complacent. Vigilance is key.
Agreed. Do you think our public health systems are better prepared now?
I'd like to think so. We've learned a lot, both from successes and missteps. It's an
Right.
opportunity to apply those lessons to new challenges like HMPV.
It's kind of like we've had a trial run with COVID-19.
Exactly. It's like we've been, given a stress test. Now we can leverage that experience.
But are people willing to continue with precautions like mask wearing and social distancing?
That's the challenge. Some people are eager to return to normal, but it's important to remember that these measures protect not just ourselves, but the most vulnerable among us. It's
Yeah,
about community health.
absolutely. So what's the main takeaway for our listeners?
Stay informed about HMPV, practice preventive measures, and don't dismiss it just because it's not new or as severe as COVID-19.
Right.
Being proactive can make a significant difference.
Couldn't agree more. Better to be safe than sorry.
Precisely. And remember, these practices help protect against a variety of respiratory illnesses, not just HMPV. It's
Exactly.
beneficial all around.
So let's all commit to doing our part.
Definitely. Together we can help prevent the spread and keep our communities healthy. Let's stay
Absolutely.
vigilant.
Thanks for breaking this down. It's been really informative.
My pleasure. Always happy to share important information. Take
Yeah.
care and stay safe.